I just want to thank the organisers for putting together this event. A lot of hard work goes on behind the scenes. I'm going to talk a little bit about airway changes today. Okay, so this is last year, very interesting. And okay, so sleep apnea, a serious life-threatening condition when people stop breathing when they are asleep, and it has many kind of medical conditions associated with it, such as hypertension, stroke, obesity, and patients have a poor quality of life. It affects so many people, very common in the US, about 1 billion people worldwide, over 50 million people in the US who are undiagnosed and untreated. It's about 80% of cases. And so this is a very common condition, and we're looking to see how can we improve this. So the current treatment kind of methods that are available are to use a mask over your face when you are sleeping, continuous positive airway pressure. It's about 85% of cases that are prescribed this. Most people find it difficult to be compliant with this type of therapy. It's difficult to wear a mask over your face when you're sleeping at night. If you've got a beard, it's very tough. And if you stop using the device, you are at serious risk of having maybe a stroke or a heart attack because of the side effects of sleep apnea. The other option is to wear a mouthpiece inside your mouth when you are sleeping at night. And what those mouthpieces do is they hold your jaw forwards and open your airway. Again, everybody doesn't want to sleep with some device in their mouth every night for the rest of their life. And if you stop wearing the device, the chances are that the sleep apnea will get worse. There's an increased risk of death and decreased longevity because of the sleep apnea. Third option is with surgery. The current trend is these implantable devices where you put a sensor into the chest. When the person stops breathing, you get an electrical stimulus. It pushes your tongue forwards and opens the airway. Problem is, it's very invasive, it's very expensive. You're talking $50,000, $60,000 US if it's not covered by insurance. And the other options are different types of surgeries, very kind of major advanced surgeries, maxillomandibular advancement, the top jaw, the bottom jaw are surgically brought forwards. A very expensive invasive procedure, and some of these may not be covered by Medicare or insurance, so kind of increase the cost there. 85% of people are not compliant, are prescribed CPAP. Recently, about 9 or 10 million devices were recalled by Philips because of the components of the device, and about 5% of people are using these oral devices in the US. And so what we want to do here is I want to look at it non-surgical, non-electrical, non-pharmaceutical, extra-oral signaling to say, can I produce something similar without doing any surgery, no drugs, managed during the daytime, not at nighttime. This is the ansa cervicalis, the nerve supply towards the airway there. If you put electrical signal in here, it opens the airway. You can see that it gets wider. And what I want to do is do the very same thing without using any electrical signal. And you can see the little prototype device there. It's attached to the outside of the neck. You wear it for 15 minutes every day. You do not wear it at night time when you sleep. It's 15 minutes a day. And what we found is that it started to produce these changes, and we took the ultrasound to say during inspiration, and when you breathe in, and then you exhale completely. We've measured the airway to see what kind of response we were getting with and without the signaling in place. And this is the very first 4 consecutive patients that we picked. I didn't select anything here. It's the first 4 people. And what happens is, did the airway get longer? Yes, it did, when you apply the signal. Did the cross-sectional area improve? Yes, it did, when you apply the signal. And the airway volume, you can see, also increased. The reason I use the green line is this is a reflex called caudal traction. When you elongate the airway, it's a muscular reflex due to mechanoreceptors the airway opens up, and this is the method we're trying to actually harness. So it's producing something similar to the surgical options, but it's non-electrical and it's non-pharmaceutical. Very small sample. We just started this study, and so this is the way we are going into the future. Thank you so much for your attention.